Utah dental hygienists, like their counterparts nationwide, they're facing a lot of concerns when working for us dentists. I can't imagine what those might be, but based on recent information, there's some key concerns that they have. We've had some legislation here in Utah that we'll talk about, but more importantly, I am surrounded by 3 of the top hygienists in the state of Utah, probably nationwide. I think they're the best, and they work for me. I've got Nichelle and Courtney and Laura. And we are going to be joined by them in this podcast. We begin that podcast right here.
Welcome, all of you fantastic dental podcast listeners, to the My Practice, My Business Dental Podcast Show, where we help dentists profit and thrive with excerpts from the clinical business of dentistry training here at My Practice, My Business. We'll be addressing and answering questions with current trends dentists and their teams face each and every day in their pursuit of this wonderful career we call dentistry. And now the host of our show, the clinical director and president at My Practice, My Business, Dr. Rob Thorup.
We're here at the MPMB studio. You might hear a fire truck go by or any kind of siren or a really loud motorcycle. We love it keeping it here in our office. We're not in a soundproof facility, so you know it's real. So I want to introduce, first of all, I've got Nichelle sitting here with me. She's... Nichelle, how many years have you been working with me now?
I've been here 11 years.
Wow, 11 years. What did you do before you worked for me?
I went to school to be a hygienist, and you hired me right out of school.
That's crazy, right? Have you temped for a few places, though?
Yeah, I've temped and covered maternity leaves for people.
We're going to cover a little bit of that. And then next in line is Courtney. I'm looking here in the circle. Courtney, how long have you been working with me for?
I think this is about 2.5 years now.
Nice. What did you do before that?
I've been a hygienist for 9 years, so I've worked with multiple practices in multiple states, and I've been temping for the past 2-3 years since I've been here in Utah.
This is really fun. So we have Nichelle, who's worked with me and has been spoiled from day one, and then we got Courtney that's going to enlighten us on a few things. And then last but not least is Laura, and she's sitting next to Courtney, and between Courtney and I. Laura, how long have you been working for me?
It's coming up on 2.5 years, about the same as Courtney. And I'm the old one. I've been a hygienist for 17 years.
17, Gal, you're like prehistoric.
I am. I'm the grandma. The irresponsible grandma.
Are you a grandma?
No.
Oh my gosh, I didn't think your kids were quite that old. That would crack me up.
That gives me a little heart attack.
Yeah, it'll happen sooner than you think. So anyway, because I'm a grandpa man. So we're going to have some fun. We're going to talk about a few things. We're going to talk about a lot of stuff and that has been on our minds. I've been wanting to get all 3 of my team members together and talk about hygiene and things that are going on in the hygiene world. But something that just hit us just the other day is I had we don't lose a lot of patients to periodontal offices because we treat periodontal disease here extremely effective. Is that fair to say?
Absolutely.
Yeah.
Yes.
And something that's going to shock all of you, we actually eradicate periodontal disease. Is that fair to say?
Yes.
Totally.
Yep.
And do we put these patients back on 6-month recare?
We sure do. I saw one today.
And how long have, Nichelle, you're the senior here. We've been doing this with you since how long?
I think it was like when I started working, maybe 2 years in. So 9 years.
That's crazy, right?
Yeah.
What percent of those patients have reverted back to periodontal disease that you've seen?
Oh gosh, like 95 or more percent probably.
Revert back to periodontal disease?
Oh, I thought you said revert back to 6-month prophy. Revert back to periodontal disease. I don't know what percentage, but it's usually only those people who smoke or just don't do good home care.
Yeah, exactly. So I mean, we always say our periodontal protocols are 95% effective, non-surgical, right? And our patients, I mean, I can count on one hand how many patients we've had to surgerize, and that's just usually pocket reduction. Mm-hmm. I mean, but you ladies do a killer job on treating periodontal disease, unlike anybody else out there. And my hygienists back in the day, Annette, were the ones that pioneered what we did. We're simply treating periodontal disease like medical would treat it. But we've had a couple patients that have sneaked through the the cracks, let's say, and have gone to a periodontist. And I just got a periodontist or a group periodontal practice that sent me a letter asking on the patient if we could do 2 prophylaxis cleanings a year, and then they'll do the 2 perio maintenance a year. This lady, we had her in. I can't remember which one of you had her, but we probed her, and she's bleeding on probing still. I mean, it's like, and was it you, Nichelle?
Yeah,
and,
it was me.
Yeah, okay, good. So you know who I'm talking about. And have they cleared up the periodontal disease? No. So she has periodontal disease.
Yeah.
Now, Tracy and I, when we saw the letter, I showed it to Trace, and I'm like, they can't do this. This is like, it's a malpractice capability, but it is illegal according to the ADA Legal Counsel. It's all over their website. You can Google that. But a lot of practices, Courtney, what you were saying, a lot of practices do this very thing.
Yes.
How
it's
much?
Very common to see.
Why?
You got me. I mean, I guess more so they're trying to utilize their insurance benefits to their advantage. But again, as you said, it's illegal. So
Crazy. So I wrote a kind but firm letter to the periodontal team there, and I said, I'm not going to cross that line. And this patient needs to either be treated with periodontal disease, and once she's free, once you've done your wonderful 4 quads of SRP and forever perio maintenance, or as hygienists have called it, forever supervised neglect, if that patient by some small miracle eradicates the infection in their gum tissue and they're back to full health, yeah, we'll start doing prophies on them, but not until then, correct?
Correct. Yeah.
Well, and she's never going to get better if we're treating it as a prophy. Because if we're not treating it as a prophy, we're not going under the gums and cleaning out infection or placing antibiotics or anything. We're just doing a regular prophy. And so she's never going to get better if you're treating a periodontal patient as a prophy patient.
Exactly. I want to just, I mean, obviously we have a hygiene summit. We talk about our protocols, and our protocols are seeing the patient. We actually are following medical protocols on treating infection and not treating to insurance limitations or treating it to the standard. And I'm not going to call it the standard of care. My fun factor's over with calling it the standard of care according to the periodontists of the world. But we actually treat infectious disease. Periodontal disease is an infectious disease. We treat it like medical would treat it. Is that fair to say?
Yes, absolutely.
And how often, I mean, just go ahead and tell the audience your protocols. I'm your patient. I got periodontal disease. Doctor comes in, me. I co-diagnose with all of you. And then just like we did today, Nichelle, on that patient. And what, when the patient hits the go button, then what do?
We take a spit analysis to check the bacteria in their mouth and do a 3D x-ray.
Wow. And what do both those tell you?
Exactly what bacteria we're working with, how much, what antibiotics we should give her. The 3D x-ray we can look at to find and see the bone loss like a lot in more detail than a 2D x-ray shows you. So then patient comes back and you have them scheduled. How long do you guys schedule them for? Ladies, I should say. Sorry.
2 hours. 2 hours to do that full scaling and root planing.
But then you hear people say, "Oh, I can only do half the mouth in 2 hours." What do you say to that?
Try harder.
And I, just like I do in training, I'm like, I had 30 minutes at Oregon Health Sciences to pass board exams. 30 minutes, one full quad. We didn't have sonic scalers. It was all by hand. And 30 minutes to clean a quarter of the mouth spotless. If it wasn't spotless, we failed. And so you all have technology. You all have great stuff to work with. So I'm with you. Try harder.
I think it's not underestimating their capabilities. They just get comfortable with the hour and a half and they think, oh, I could not do that faster. But if they really just get in there,
two
get
quads
it out.
in 90 to 120 minutes.
Yeah. Then I think they just need to improve their skills, continue to learn.
Well, we'll go right back to it. If you do the right side of the mouth only and the left side of the mouth's untouched, what are the bacteria going to do on the left side of the mouth? Stay put? Or are they migrating?
Migrating.
Well, maybe those hygienists don't have the right tools. Maybe they need to talk to their dentist to get a nicer ultrasonic, to get nicer instruments so that they can actually do their job.
Which
Effectively.
is one of the primary complaints that we get from hygienists all the time that we talk with. They don't have the appropriate equipment tools. What do I do with all three of you? Do you get everything you want?
Pretty much.
Yeah, it's not even a
Was
want.
there something I'm missing?
it's not really a want.
It's not a want.
Like she's saying,
it's a need.
to do my job.
It's
Yeah.
like asking a dentist to use like super old, dull burrs to do his work.
Yeah.
That would be ridiculous. So
Spot
why
on.
are you asking the hygienist to do that?
Oh my heck. Isn't that funny? I hope all you docs out there are listening to that. The hygienist, this is one of their chief complaints. And I want to talk about chief complaints. Sorry, my voice is going. It's the end of the day. Chief complaints that hygienists have with their docs that they don't give them. And while we're on that topic, I mean, I know we're going to bounce around for a minute or two. I want to come back to that. Don't let me forget to come back to that right after this. But so you see me for a couple hours and you're doing SRP, right?
Mm-hmm.
Placing antibiotics.
Yep.
How many offices, Courtney, do you and Laura have you gone to and they don't place antibiotics? Tell me about that.
Almost all of them.
I was going to say it's a very small percent that do utilize antibiotics, unfortunately, because it is such a great tool and we've seen spectacular results with it. So
Why don't they use antibiotics? What have you heard? What's their excuses? What's their reasoning?
Arrestin was not, it was expensive. It expired. I remember right when I graduated, we did use Arrestin, but patient compliance, they're like, oh, $40 a spot. No, thanks. And then it would expire. And so we just kind of stopped.
So from a business point of view, at $40 a spot is what you were charging. We were charging $80. The Arrestin itself, the Compule was $40, and I saw so many offices only charging for what the cost of the Arrestin Compule was.
Yeah.
Isn't your time valuable?
Apparently not. But
Shouldn't
yes,
you
it
be
is.
See, and then they wonder why they aren't, profitable in their procedures, and they wonder why and we won't even get into that today, but the hygiene department oftentimes is a loss leader in the practice. It can't stand on its own, but neither can the dentist stand on his or her own either, because composite fillings are upside down. Crowns are upside down. There's only two components that dentists are profitable on: 3-unit or more bridges, and implants with the attachment crown using the cheapest implant, cheapest attachment, cheapest crown. Otherwise, no. You start using Nobel Straumann, you're screwed. You're upside down. You're in the red. But dentists don't understand that principle, but they wonder why they're working so hard and the cash flow isn't there, which is really interesting. Oh, there's so much I want to go on. Okay, what were we going to... So then you bring me back. You do all that stuff. You put me on a medicated mouth rinse, right?
Absolutely.
Is it chlorhexidine? No, never meant for long-term use. Okay. So we're using a couple products, mostly Oracare, but we use Carry-Free depending on the situation, but mostly Oracare. What kind of results have we seen with Oracare? What have you seen?
I love Oracare. I've seen great results. I've never used Oracare in any other office, and I feel like using Oracare here has been really eye-opening.
Amazing.
To what a product can do, for sure.
Yeah. Yep. Couldn't agree more. So then I come back. Let's see. So you've done SRP. You place antibiotics direct. You put me on a systemic antibiotic. What a concept. It is an infection. We should treat it like an infection. You did a lab test on me before you even gave me an antibiotic. What a concept. Put me on a medicated mouth rinse. And then don't you want to beat me into submission on oral hygiene instruction?
Sure do.
Yeah.
I think we just find that very few people know how to actually brush and floss. And so we take that time and we go over it as thorough as you can. Now you try it. Show me what you do. And we show them how to do it in their own mouth. And it's eye-opening.
So
to know
what
him
you're
and
doing,
you don't know how to do it.
you're showing by explain, demonstrate, guide, and enable.
Yes.
You're using the EDGE method to teach, and you're using mirrors and actual toothbrushes and floss. What a concept.
Yep.
But what's the chief complaint that most hygienists have?
We don't have time.
Oh my gosh. All the time, they have no time. And they're right. They cram the schedule, don't
Double
they?
bookings.
Mm-hmm.
Yeah.
Yeah. And we've seen triple bookings too. Crazy.
My favorite.
It makes me want to cry.
Burnout. Okay. So then then we, that's because I'm not profitable, and it's up to you to help me be profitable. So if you're not seeing 25 patients an hour, how can I be profitable? This is the business mentality of the average dentist in the United States of America, right?
Yeah.
And what they're trained on and taught by all the consultants out there. Isn't that weird? Except for here at MPMB. We don't train and teach that. So then you bring me back. How many weeks do you bring me back in?
6 weeks.
Why not 4?
Because it takes 6 weeks for the body to reattach.
Yeah,
The gums
5.
to reattach.
5 weeks, 2 days. So you don't want to see it. So 6 weeks is a good time. Some of the institutes teach 7 weeks, and I'm okay with that too. But 6 weeks, we've been doing that with how much success? Huge success, right?
Huge. I would never go back to seeing them only every 3 months.
My favorite was on a post in a dental networking group. Our hygienist likes to see some patients 4 to 6 weeks after SRP to see how everything's healing. Some patients, I about died. And is it 4 weeks or is it 6 weeks? And then it's like, is there a code for that? And everybody on the networking group, I wouldn't charge. Yet every one of the 3 of you want to make money, don't you?
Well, we need to.
Yeah.
How can I pay you if we're not billing for your time?
Well, and at that 6-week appointment, we're doing periodontal maintenance, or essentially scaling and root planing over again. In school, we learned you bring them back for the 6-week appointment, but you're just probing. You're just seeing if they're healing or not, and that's all you do. And it's like, what's the point of that?
Oh my gosh,
But-
I didn't know that.
So
Oh,
yeah,
yeah.
we're
That's-
actually re-cleaning, rescaling at that 6-week appointment.
Adding more antibiotic.
Yes.
Going
What-
over their
More
oral
mouthwash.
hygiene again.
Oh no, I know you're doing that. I didn't know that you just school teaches you just to probe
yeah.
and see
Yep.
how they're
Yeah.
doing.
And so that's why people kind of tend to eliminate it, because they feel like they can't bill out anything because we're not really doing anything but checking healing.
Yeah,
And so it kind of seems silly. So then they just throw it all out and they're like, well, I'll see you in 3 months.
yeah.
Yikes.
That's nuts.
It is.
And then we'll see you in 3 months.
Yeah.
From the 4 to 6 week point, and then we're going to see you in 3 months.
It would
No,
be 6
it's-
weeks after that.
Yeah.
How many of those patients on 90-day perio maintenances that you saw throughout your whole life, how many of those patients healed?
I'd say
Crickets,
None.
people.
yeah,
They're
I was gonna
shaking their
say
head.
Very,
Nothing's
very
going.
small percentage, if any.
Yeah.
Most people, the first one back, it's definitely like Nichelle said, another scaling root planing almost.
So what we're doing is we're seeing everybody every 6 weeks, because that's how the body heals in the non-keratinized tissue of the mouth, and you're hitting the infection every 6 weeks, knocking it down until it's gone.
Correct.
That's the protocol. That's what we've been teaching
That's
for
it.
years. And yet, you know how many periodontists have thrown arrows in my back and badmouthed me and said how terrible of a person I am to be having been teaching this for years? Because I came from medical. That's where I got my start. And I would work the ER and take care of infectious wounds. We didn't have, back in that day, we didn't have wound clinics back in the day. I'm so old, you guys. Now we do. Now we have wound clinics. Shoot, we have a patient that's a physician, and his specialty is wounds and infections on the body. That's what he specializes in. I don't even know the name of the specialty. Shame on me for not knowing that. But if any of you know it, I mean, spit it out. Anyway, he's an infectious wound physician. Yeah, that's what he does. And it's just kind of fun to talk with him about stuff with what we're doing. He's like, Rob, keep doing what you're doing. That is what makes sense. And what your old protocols were, he said that makes no sense to, what he knows and how they treat infected wounds on the body. So then you keep bringing them back until they graduate.
Yes.
Yeah.
Laura,
Best day.
is periodontal disease, is it a life sentence?
Not anymore. That's what I love is you're not saying, oh, you have perio for forever and always. It's guess what? You have an infection, but we can heal that. We can get it out of there, out of your body, out of your mouth, and you're healthy again.
How many of our patients that have been on 6-month recare for many, many years now, if they went to another office and they saw them for the first time, would they diagnose them with periodontal disease?
Never.
Hundreds of cases that we started tracking. By the way, last time I checked, we were over 375 cases since 2019. So I've been keeping an eye on that. And I should publish that in a journal, but I don't have time. But I hope all of you that are listening to this. But now I want to dive into going back to which one of you said, how hygienists are like not appreciated, not considered part of the team, do you guys feel that way here?
No.
Oh, no.
Absolutely.
I try to make you not
I
part
feel
of the team.
so valued and respected for my professional opinions. We'll talk together. It's a group effort, all of us.
Well, when you're prolonging and saving lives and you view yourself as that type of a healthcare provider, I think that for me, that was that aha moment that I had when I all of a sudden realized, especially when we saw the NFL player die of periodontal disease a few years ago. We had a person in Heber City, Utah die of periodontal disease. We had people in, I mean, there's a lot now that we're seeing where the actual contributing factor for their death was periodontal disease, both young and old. And so I'm going, why are we not more aggressively treating this infection? And when I look at that and I look at all of your wheelhouses, ladies, I'm like, that's a big wheelhouse. And when you start thinking about that, I mean, we've had patients that I have talked to lately with just gingival inflammation, gingivitis, and you all clear it up. And by the way, our gingivitis protocols are way different than anybody else's either, which is something we train on. When I see that and I have patients go, "God, I feel better. Could my gums be affecting my energy level?" That's what they call it, energy level.
Oh, yeah.
All the time.
I had a patient just last week who said every winter he struggled with asthma and he'd have to carry his inhaler in his pocket because he always had to puff on his inhaler.
Wow.
We diagnosed him with periodontal disease. We got him all cleaned up. He graduated, I think, in the late summer. And he said this fall and winter, he did not have to use his inhaler once.
Wow.
And again, the body's immune system working overtime.
Yeah.
In
yeah.
the mouth.
Really.
That's crazy. Well, let's go down this track here a little bit. In the state of Utah, we had some legislation that got passed, and hygienists can now are going to have, they don't have it yet, but it's been passed to have expanded duties to do fillings and dermal fillers and remove cement from teeth with braces. I'm going to say it. That seems so, it seems so, I had the word in my head, so minor compared to what the three of you are doing and what you help other hygienists when they come through training, what you help them with and your comments and your statements to them. I know that we have hygienists phone call in from other offices asking questions after training too. And that expansion, even if you were given autonomy, could practice on your own. I would miss you. First of all, number one.
Oh, we'd miss you, Rob.
Number one, thanks. And number two, it's like, I think we have so much fun co-diagnosing together.
For sure.
And yeah.
Mhm.
And then, I go in, I'm like, yeah, exactly what Nichelle and Courtney and Laura said. You've got periodontal disease and we're going to fix it and we're going to eradicate it. And I'm like, and I No, it's like you guys. It's not me.
You provide the building. It's great.
Yeah.
And all the things.
I buy the stuff for
liability.
you.
Well, I think what's interesting about the co-diagnosing is I can see that something's going on, but since I do not place the restoration, I don't know exactly what type of restoration is needed. I don't know all the factors to look at, how big that decay is, how, we have guesses, but it's not our wheelhouse. And so if you're not there, I can say, hey, I see something going on. Let's see what Dr. Rob thinks needs to be done to fix it. And I think that's the biggest thing is I can see something's going on, but I can't always guarantee how to fix it.
I love what you just said there, because when we have a perio patient, I literally, you guys hear me say it all the time, follow my hygienist with strict instructions. Do not shortcut what they tell you to do. It takes both of you to eradicate this disease, and that's your wheelhouse. And I watch each one of you, by the way, do little transitional changes here and there based upon the patient's needs. I see you keep the basic program, but you'll alter meds, you'll alter mouth rinses, you'll alter, I love this, brushing techniques, flossing techniques that I don't see, you're seeing it. And you actually care about people. So when I'm talking about the Utah legislation in other states, Colorado and places that are trying to, I think, kind of diminish, because assistants, can scale and polish. I think that diminishes the overall healthcare. Sorry, assistants, I love you to death, but you don't have the training that the hygienists have, and it diminishes what you all do for the patient. Am I speaking too plainly and too honestly there?
No, I think that's right on.
It's like the other thing that, so with the legislation, again, I'm going to say, great, you're expanded. But I think that is so insignificant to what your capabilities as a hygienist are in the overall health of the patient. Anybody want to elaborate on that?
One thing I could say is, since I have been a hygienist for a long time, I was a hygienist for 15 years before I found this revolutionary way to cure periodontal disease. And so you do get to a point where you're burned out and you feel like there's nothing you can do that's even going to change it. So it's just kind of this rinse and repeat, banging your head against a wall. And so I think a lot of hygienists have started to devalue how important we are, because we can't do anything to fix it, because the patient only wants to do what insurance will pay for and doesn't want to put in the work. Everyone wants a quick fix. And so it's just so hard. So I think that industry overall, we're just frustrated and just downtrodden. I don't know. And so we don't value ourselves enough to be like, hey, we can do this better.
Not everyone has the support either, right?
Yes,
and that's huge. Like when you as the hygienist are trying to implement something and put all your time and efforts into it, and you don't have the support of your team or your doctor, or even like we were talking about the insurance companies. I mean, it's exhausting when, like you said, the rinse and repeat. That's how it feels.
What's really interesting to me too, and I sorry docs, you're out there. I'm not going to name names, but I am going to divulge some things that we're seeing out there. We've had a lot of docs on the perio program. They've come through the training. The hygienists see it. And then the docs will step in and go, I don't want to charge that code. It's $950. I don't want to charge that because I don't really fully understand what it was for. Number one, in training. So what that tells me is they weren't paying attention in the training, because as soon as a dentist hears periodontal roundtable or hygienist roundtable or the modules on periodontal disease, most dentists tune it out because they're like, oh, I don't need to hear that. That's what the hygienist does. And that's the problem. Then they can't support the hygienist because they're not seeing the research, the training that we're giving them. And so we've heard that a couple of docs in certain areas in the U.S. that have been through our training, oh, I don't want to do that. We had one of them. Well, not one. We've had several. I don't want to prescribe antibiotics, systemic, because that's too much antibiotic. What would medical do? I'm trying to hold the adjectives back, like dipstick, ding-a-ling. I'm sorry, docs. I'm calling you out. What would medical do? And you were here at the training. I've taught you. And then all of you who've not been through training who are listening to this, think it through. What would medical do? Now I'm going to ask all three of you. If we weren't placing antibiotics directly and systemically, would you see the results you see?
No.
Docs, you're hearing three people that are on the front lines of this every single day, eliminating periodontal disease. Go ahead, try and call us out, you periodontists that might be listening. Go ahead and talk to any of the three of my hygienists. Don't get them all together. They'll eat you for lunch, but one-on-one, they'll still eat you for lunch.
Yep.
Because they live it, see it, and they have broken away from the status quo of what the perio protocols currently are. Is that fair to say?
Yes.
Yeah.
Okay. Don't shortcut what you're trained on here at all. That's like the workplace environment and conflict that we see all the time, which is one of the main concerns that hygienists have nationwide. They don't have that collaboration or support from the docs. Another one's like ethical considerations, just like the one that I talked about earlier with the periodontal office saying, do 2 prophies a year, we'll do 2 perio maintenances a year. That way we'll maximize insurance and the patient will be getting some really good cleanings. No, they probably need more SRP. Am I correct?
Yeah.
Unbelievable. And then here's another one, though. Job satisfaction factors. You guys talked about burnout. Have you worked in offices where you've been double booked all the time?
Yes.
Mm-hmm.
Do you get burned out?
More than burnout.
Yeah. Like
Can't
yeah.
move some days. I go home and I just lay flat. I lay horizontal. I tell my husband all the time.
Well, I
just
do
wanna
that, but I'm
lay
in my
horizontal.
60s.
Yeah.
No,
Well, I'm only 30. So it's not normal.
Do you hear that, docs? Burnout. I mean, it's funny. Nichelle was looking for her rolly thing for her back today, and it's like, where's my rolly thing? So I don't know
Stretch
how.
my back.
I don't know
Yeah,
how
it
it
hurts.
moved it, but
I was sitting in your massage chair.
I was just going to bring it up. Docs, we actually have a full-on massage chair for our team members. Why do you think we have that?
We need it.
Exactly. So, and then it's like, you guys have to have balance.
Oh,
You have-
100%.
And Nichelle, I remember you working for me years ago and we would do triplets all the time,
Yeah.
right?
Yeah.
Now, I didn't want to get into how I pay all of you yet, but I also don't want to run out of time on this. Simple. I pay my hygienist $20 an hour and they're happy.
That's all
wait.
we need.
And and they make 18% of their production. They're paid $20 an hour because if they have a patient cancel, they're in there straightening up their room, sharpening instruments, calling, recall. They're filling their schedule. Tell me you guys are filling your schedule sometimes,
Yes.
Yeah.
When I
right?
get the chance, yes.
Because you're
absolutely.
still making a base salary, and you know that if you're but the team tries to keep it pretty full. Do they do a pretty good job?
No,
They do
absolutely.
great,
Yeah.
yeah.
They do a
So-
fabulous job.
So in our office, we have the doc extraordinaire. That's me. And then we have the hygienist prima donnas. That's the three of these ladies here. And then we have front office and back office. And one of my favorite in the recordings trainings is, Nichelle, you taking a payment from a patient over the phone. What a concept. Our team is cross-trained. Isn't that amazing? I'm curious, though, how many of you submit claims to the insurance companies? Are any of you doing that? I know Nichelle
do.
does it.
Yeah.
Yeah,
We do
every
that.
day.
Uh-huh.
Well, I just want to see if Tracy and Tanya are training you all like you're supposed to.
I
That's
don't know. You ask them. We don't see them come back. We just submit them.
Yeah, yeah.
well, they must be working if Tanya
Yeah.
hasn't yelled at you. So anyway, that's what I'm talking about. If they have downtime or as they're going along the day, they'll pop in and submit the claims on their appointment. It's so easy to cross train. Again, something that we teach here, but what's been really fun for me is this is a concept that so many dentists cannot wrap their heads around. When my team makes the practice more income, the percent payment to them actually decreases. In other words, they'll be at about 25 to 27% of their production goes out to their salary, which is, a little bit like, well, sometimes if there's no perio, no anything that we teach and train on, if they are traditionally doing it, it would be about 34%, because every now and again, one of my team members, there's just nothing. The patients are healthy. And so the actual amount that they're paid does run 34%. I'm not making any money at that percentage. I'm paying them to be there. But my team average pay period over pay period over pay period is between 22 and 25%. Guess what? They're making me money. And when they have really good pay periods where they're making 80, 90, $100 an hour, then they're making like 20, 21% of their pay, of their production is going to their pay. What does that mean? They're being paid like an associate. When a dental associate gets paid, most associates get paid 30% of production, like they do around here. My hygienists are paid 24, 25% of production. And most of you out there would freak out if you paid your team members straight production like that. The other thing, some of you do pay a higher percentage. And if you do, and you're billing traditionally, that's why you hate your hygienist. And that's why there is conflict in the office. You know, me, I want to, anytime my hygienists go into a 80, 90 above hour pay period, I'm like, thank you. I congratulate you all, don't I? Good job. You did a great job this pay period. Can you do it again? But it's not like we don't overdiagnose perio like we've seen in some offices. Have you guys ever seen that?
Oh, yeah.
Mm-hmm.
Yeah, no. We have our criteria.
Absolutely.
4 millimeter or greater pockets, bleeding on probing, radiographic bone destruction. When we co-diagnose together, if you can't prove that to me, that's not periodontal disease. That might be just gingivitis, right?
Yep.
Yeah.
So we go by the book here. Why? Because I'm under a microscope. Tracy's under a microscope. So,
And it's just ethical. Like, we are ethical humans, and we just want to treat people the way they need to be treated.
that, yeah, you want to clear their infection or you want to maintain it forever.
Right.
Supervise neglect. That's my favorite. So my $1 million question to all of you on this is, what are your chief complaints out there in the field? And before we do that, though, this was a really interesting, the top complaints that patients have in the state of Utah about their hygienist. Have you seen this? This was pretty funny. Poor quality of work and pain during procedures.
Mm-hmm.
Okay, wait a second. If patients are picking up on that, that's a killer. I know that you guys had the husband-wife split, who had perio that was referred to us, who were going to a periodontist, and came to us, and you guys cleared up their perio. They're back to 6-month recare.
Yep.
That's the kind of referrals we get. And I love that. I love that we have that kind of reputation. Without naming any names, you want to elaborate on that at all? Because I know you guys know the story more than I do.
It's interesting because they go to a specialist and the specialist couldn't help them.
That's their
fully.
statement. That's what one of the husband and wife said.
Yeah. And they're like, well, we heard that you can get rid of this. And my periodontist just said, I have to come every 3 months. And that's just how my life is now. And I'm like, oh, girl, we have a way effective way to do this. And she was the first one to come in. And I remember she was excited for her husband to come in and hear it all. And she's like, I'm sold. This is great. And I just saw her again for her first 6 months following, and she looks immaculate. She looks great.
So if she went to another practice, she'd never be diagnosed with periodontal
Oh, never.
disease.
They'd be like, you have the cleanest teeth. Keep up the good work. You look fabulous.
And we saw the husband with you,
Yeah.
and he looks great too.
Same.
Pink,
Yeah.
stippled,
Yep.
pockets sucked down, no more
Both
bleeding on
eradicated,
probing.
Just like that.
So cool.
They were probably sharing it back and forth.
Probably.
Ew.
Fun fact.
Yeah, no kidding. Patients say they received inadequate cleanings. And I'm going to, all you docs out there, if you're not holding your morning huddles, like we don't all the time, I have to confess, but we hold team meetings every month. We talk about this, and I love it when we have patients come in. How many times do we have patients come in and say, this, like I just had another patient say, oh my gosh, this is the most well-run office. Your team was so on top of everything. And that is the best cleaning I have ever had. If I had $1, I'd be retired from all three of you. There's not one of you that we don't get that same statement from over and over and over again. But why do they do that? Because you all have time to take care of the patients. We're not a cattle practice.
Yeah, I think patients can track when the hygienist is feeling stressed or is in pain or is in a rush.
Or the hygienist spent 5 minutes.
Yeah, they can sense that. They track that, and then they don't want to go back. And they don't feel that here.
Yeah, that's so crazy.
I've actually been to a few practices where they've picked up on being double booked. They've asked specifically, are you double booked? Because I'm running behind and I'm stressed and I have to be quick and efficient with my time, and they feel rushed. So I've been to many offices like that. The patients are not dumb. They pick up on that stuff.
They have Google. They have AI on Google now. I mean, seriously, this is where I pulled a lot of this stuff from weeks ago. Lack of information and communication. Again, I can't tell you how many patients have said, Laura, going back to your point, nobody's ever taught me to brush and floss like that.
Mm-hmm.
I hear that all the
Yeah,
time.
all
no
the
one's
time.
ever told me any of this.
And if you're double booked, like if we have to sit down and only scale, we don't have time to teach them anything. Like I'm teaching them as I'm flossing after I've polished, or I talk about it. Because if you're just scaling, you're just like, okay, get in, get out, and to the next one. And you just don't have the time to do any of that.
Especially if you're waiting for me. That's like your perfect time to spend time with the patient, right?
Just hang out.
Failure to detect oral pathology or periodontal disease. Now, with our medical malpractice insurance carrier, I mean, we've seen some offices who have overdiagnosed periodontal disease so they could get paid more from insurance, which is stupid because they don't realize they're upside down on the amount of time that they're taking and what they get paid on to do stupid stuff like that. But tell me your experience in most offices when you see bleeding on probing and pocket depths. What have some dentists said to you all?
Just clean it up.
Mm-hmm.
And they've come in for the exams, and after I'm done with my cleaning, everything looks great. What do you mean? This person has pockets and bleeding everywhere. Their gums are just a hot mess. Oh, everything looks great.
Mm-hmm.
Thanks, doc.
Or clean it and we'll check it next time.
After you've told the patient, it looks like you have periodontal disease.
Oh, yeah.
Yep. Totally undermines you and what you wanted to do and
Been
needed
so
to do.
undermined.
And again, in defense of the hygienists in Utah and other states, this is why a lot of them consider autonomy. They would like to practice on their own when they don't have a doctor that supports your wheelhouse of prolonging and saving lives. Because they downplay the disease. And I was one of them many years ago.
I was gonna say, I was one of them 2 years ago before I found you. And I was like, you're right. I'm more than a mouth janitor.
Oh my gosh, you come up with the funniest things. Injuries to patients, that's what they call it, is their complaint. Not protecting patient privacy. I mean, Courtney, thank you for, everybody teases you about, being the OSHA patrol around here, but I want you to know I'm grateful.
Yeah.
Because you have to.
I've just seen
no
way
HIPAA,
too much.
OSHA. Yeah, you've done a great job, and it's been really good that we're quiet up front over here, on one side of our counter presenting treatment. Patients are over on the other side. Sometimes it gets a little blended. We got to make sure the team is up on that, but we're due for another OSHA training, aren't we? And
We
HIPAA
certainly
training.
are, yes.
So when are we getting that? You need to be. I'm assigning you that
All
right now.
I got you, doc.
Perfect. And then practicing outside the scope of legal duties. overscheduling and time management issues, which you've all indicated already. I thought that was really interesting. So it's like I read this story about this hygienist that she was actually applying to get a license in Colorado, and she practices up in northern Utah. And there was a general dentist up there that brought her on board. They talked, and she felt very similar to the way a lot of the hygienists feel around here, and wanting autonomy, wanting more control of what they do, and not being told, the patient has periodontal disease. Oh, just scale it. It'll be fine. Send them off on their 613 care. The dentist called her back and said, I want you working here only if you'll be a partner. And her jaw, I'm paraphrasing, but I think her jaw hit the ground, according to the story. And she's like, wow, I get a say. I get to actually be part of, stuff that I need, stuff that I want, sonic scalers, instruments, stuff that, that's important for you to be able to do your job and do it well. And I thought that was brilliant. And I started thinking to myself, what is it that we've been able to articulate here? And she was like, this is what she experienced. I practice under the rules and regulations set forth by the Dental Board of Utah, much like any other hygienist in the state. Well, you've just indicated to me that some dentists break those rules and regs, don't they?
Absolutely.
Mm-hmm. Just with you, and if they do it with all of you and what you're capable of, what do they do with their own selves? That would be my next question. I'm paid by what I produce. That's kind of how I pay all of you, isn't it?
Yeah.
Right? I make my own schedule based on hours desired. That's something, again, we teach in the hygiene department. In the hygiene module, in our team training, who sets their time for a patient? You all do.
Mm-hmm.
The front desk has no business making that.
Right.
Right? And then I purchase the products and equipment I want to use. And I love my story, Nichelle, about I want the $9 million Dentsply Turbo Boost Sonic
I
Scaler.
knew it was good. It was going to make me a good hygienist.
It'll
I
make
was
me.
going to say,
I am already good. This will make me better.
Rob, do you want to know what the name of the inferior one is? Called the Little Beaver.
Wow.
Wow.
And it was terrible. My last office, that's all he would buy was the off-brand tips and little beavers, and it would just leak water all over their face, all down their neck. I was like, there's no water going in their mouth. It's all over. So I couldn't even use my ultrasonic most of the time, my Cavitron, because
it was a hot mess.
It was a hot and cold mess.
Oh my gosh.
It was bad.
I have my own practice within a practice. Is that kind of what I've done with all of you? I mean, really?
Yeah.
Yeah. We have like absolute ownership.
Yeah, we do.
I am a financial partner in the business. I know you don't have stock, but she has stock. But if you don't have controlling interest in a company, you really have nothing. But I treat you like owners.
Mm-hmm.
I feel like I do. Do
Yeah.
I?
Yeah.
Okay. And you don't have to just say that because you're on the podcast right now.
I'm looking at this list in front of me, and I'm like, oh my gosh, we do get all of that.
And I'm included in discussions.
I am so lucky.
And decisions about the practice. And that's just like, it's just like today, Nichelle. I pulled you in. Hey, will you read this? Tell me if I'm off base, with what I'm going to send the periodontal office.
Yeah.
And I think, and that's where I love, I love your input, but more importantly, I respect it. And I think that's the reason why a lot of hygienists in the state of Utah wanted legislation. I think that's why Colorado, other states are like pushing for, more autonomy. And I just think if the dentist started treating the hygienist more like an associate and less like a subordinate, is that fair to say?
Yeah.
Yeah.
That I think great things can happen in a dental practice.
Absolutely.
So those are the areas that I wanted to touch base on. And I want all three of you to I know we've talked about a lot of stuff. There's so much that we talk about. But I want you to just, if there's something that we've missed in the podcast that you've really wanted to talk about, let it rip. It's yours for the next 30 seconds. No, I'm just kidding.
Oh, 30 seconds. Talk fast.
Thoughts?
No, I was just thinking that hygienists and dentists were made to complement each other and not compete with each other. And so it's so great to see this model and talk about like how we respect each other, because then we can complement each other, because your restorations aren't going to be very great if they're bleeding all over the place and the foundation isn't strong. And so if we respect each other, it's a complementary relationship and not competing. We're not competing for resources if you can be profitable.
So in my mind, when what you've been saying, thank you for saying that. And then you just brought up profitability.
Mm-hmm.
And a lot of hygienists, they want $50 an hour, and the reimbursement rates from the PPO plans, third-party payers, it honestly, truly does not justify that. But most dentists are like, I don't want to be doing hygiene. If I'm doing hygiene and working appointments, I'm going to die.
Yeah.
It's like, it's a lot, unless you have a really small practice. And so I'm like, as I'm thinking through this, the problem is I know all of you here average over $50 an hour, well over 50. And yet most dentists don't, it's like being able to offer value-added service, treat perio. This is one thing that I forgot to say. Our perio protocols, our eradication of periodontal disease, ranges between $5,000 and $6,000. Somebody, a patient, posted on Facebook from one of our clients a treatment plan and said, "This is ridiculous. This is stupid. How much they're charging." And I'm going, "Oh, well, listen up, little whiny face. Why don't you go ahead and go to the periodontist or other dental practices who haven't been trained from us or Coyce Institute or other institutes out there. If you want to go and have the infection in your mouth forever, go for it." Because I started thinking in my mind, they come back, even if it's every 90 days, they still need more SRP, but why don't the offices charge for SRP?
Insurance won't cover it.
Insurance doesn't pay for it.
Mm-hmm.
And so they are so afraid to charge for what they do. And they have trained the patients to not charge for what they do, haven't they?
Yes, we're a big part of the problem. The dental field
community.
Yeah.
And so my example is, I have a patient come in, I do 6 anterior crowns to make their smile pretty. Does that prolong and save lives? No. How much do I charge for that? Oh, well over, $6, $7, $8,000 for a cosmetic case like that here in Utah, more in other states. And everybody freaks out to have a hygienist who prolongs and saves lives and eradicates the disease process if they're properly trained to charge a patient out of pocket $4,000, $4,500. We freak out over that. Patients are freaking out over that. That's the stupidest thing I've ever heard in my life, because medical charges over $10,000 to eradicate an infectious wound.
Yeah, I was going to say, for some reason, the dental industry has been gaslit into believing that we can only charge for what insurance will cover. But if you think about it, medical, like I'm pregnant, I'm having a C-section in a few months, I expect to pay $10,000. That's what it was for my last 2 babies. My husband has had liver blood clots. He needs surgeries every few years. They're like $6,500, and it's what you pay. And for some reason in medical, we're fine with that. Oh, but when you go to dental... Oh
insurance doesn't get to cover it.
Yeah, I can't have it if insurance doesn't cover it. So
I'll say the same thing for like vet bills. I mean, I go to the veterinarian with my dog for routine care, and they list everything out line by line, the services that they provide and the cost for each service. They charge for everything they do, whether it's disposal of whatever, or it's listed out line by line.
Catheter,
so why
antibiotics.
can't we do that for dental? just like medical and even veterinary services are.
And we can. There are CDT codes
Right.
for it. And honestly, the office managers extraordinaires out there that are like, oh, we can't charge that much. That highly business trained, or I should say unhighly business trained dentists that are out there, oh, we can't charge that much. They've never read the CDT code book. They never have read a contract, insurance contract. They don't know their state laws. Now do you see why Tracy and I train on this and beat it into them?
Thank goodness.
Yeah.
And insurance doesn't have to cover it. Like there can be a CDT code for it and insurance may say we don't cover that. And okay, the patient pays for it.
I love it.
That's how it is in medical.
That's what a
That's an
Insurance-
insurance problem.
Yeah, insurance doesn't care about our patients.
No.
They don't care.
They absolutely
They're a
do not.
business. We care, and we shouldn't let insurance tell us what we can and can't do on our patient because they're not the professional, the dental professional we are.
And why are we allowing them to tell us what we could charge?
'Cause
And but
that's the
the
status quo.
That's the status quo.
Yeah.
You just took it right out of my
Mhm.
mouth. Yeah, exactly. It's crazy. And I'm thinking to myself, again, that is such a small price to pay to improve my quality of life. Because when you have infection in your mouth, as all three of you know, how many times does a patient say after you clear them up with periodontal disease, they're back on 6-month recare? I hear them all the time say to all of you,
Yep.
I have more energy. Could my periodontal disease been causing my energy loss?
Yeah.
Absolutely. You got all that bacteria going through your entire
You have
body. It affects
Chronic inflammation.
It's linked to
Yeah.
Alzheimer's, diabetes, heart disease. It's insane. The oral systemic link, it is not talked about enough.
The
It's so
bacteria can
important.
cross the blood-brain barrier. They found it in brain tissue. Like, why are people not more nervous about that? Getting
Why aren't
bacteria
more people
from your
flossing?
mouth
Yeah.
into your brain, right? And I think a lot of people see that big price tag, that like $5,000, and they're thinking of how periodontal disease is traditionally treated. And I'm like, no, they're getting so much for that cost. Like they are coming every 6 weeks. We are seeing them for 2 hours. We're placing antibiotic. We're spending so much time and resources for them. So it's not like we're just charging more money for the heck of it.
And we're curing it. So it's
Yeah.
not like they're going to have to pay that
They're just
again
paying it all
unless
up
they're
front.
not following our instructions.
Yeah.
So it's well worth that money.
Well worth it.
Wouldn't
They're
you
getting
pay it to
so
cure
much.
it?
I think we need to charge more.
I did have a patient say he showed his treatment plan to his mom, who works at a dental office down in St. George. And she's like, oh, we don't do all that stuff. We don't even do half of that stuff. And he said, well, maybe you should.
The
And I was
patient
like,
said
wow,
that.
look at how much I educated my patient. He saw the value in what we offered.
And you had the time
Yep.
to teach him.
And I see him tomorrow for a 6-month because he's back on 6-month recare.
Wow.
Love it.
That office needs to get into our training.
I know. I'll get his
obviously.
mom's business card tomorrow.
You know, the periodontal protocols are just one of the components of our team training that is so powerful. And there's so many more things we teach in the business and clinical side of what we do here at My Practice, My Business. And I hope that all of you have found this podcast worthwhile. Anybody else, any concluding thoughts? And if you don't have any, I'll wrap it up. But if you have a thought,
I have one more, but I always have
let it
one more.
rip, Laura.
So, Botox is a hot topic.
Oh.
That was brought up, okayed in legislation. And what's interesting is as I talk to hygienists in other offices, if I'm temping and just friends, what has been talked about in legislation and brought forth by these other hygienists, it doesn't represent us as a whole. That I've noticed a lot of my friends are like, I don't want to be able to do Botox. Like, I don't care about Botox. My patients need healthy gums. Like, there's doctors who can do the Botox injections and it's all for cosmetic Botox, but it doesn't represent us. Most of us just want to do our jobs and do our jobs well and be able to do it well.
Just like at the Hygiene Summit, we had all the hygienists in here in our training facility,
Yeah.
and I asked them, how many of you want autonomy? And one of them rose their hand.
And she couldn't even really voice why.
And that's crazy.
She probably wanted personal Botox.
Right? You look
Well,
at the threads and they're always like cosmetic Botox, not just Botox. They say cosmetic Botox, and that tells me a lot because that has nothing to do with their oral health.
Well, yeah, exactly.
Nothing.
And then we asked, how many of you want to place Botox? And 2 of them raised their hands. Maybe, and it was like
Maybe.
maybe, and it wasn't even the one that wanted autonomy.
It wasn't. It wasn't.
That was what was funny too.
It doesn't represent us as a whole. We just want to be able to work together with the dentist and stay in our lanes and do what we do well.
And be supported.
Yes.
Yeah.
And I think that's, and not be worked to death. And if you're paid, like if you actually know how to make money in your department with all the cool stuff that you have to increase the oral health care and overall health care of a patient, there's plenty of money to be made. There's plenty of salary to be paid out. That's my view from the business side. But what's really cool is what we're able to provide to our patients and all the people who've gone through our training and what they're providing for their patients. Not shortcutting, doctors. Knock that crap off. Don't shortcut the training we've given you. The offices that have not shortcutted, which is a majority, they're doing exactly what they've been trained on. They are seeing such incredible results, and they love what we do. We have a YouTube channel. Hope that you go and listen to the Hygienist Roundtable that we have on the YouTube channel. That might give you some more inspiration. But ladies, thanks for taking the extra time tonight after work to
Thank you, Rob.
Yeah,
have
it's been fun.
this
Thanks for having
discussion.
us.
It's fun. All four of us hardly ever get together at the same
I
time
know,
unless
it's
it's a
cute.
team
Work
training
different
or
days.
team
Let's
meeting.
do this
Yeah.
again.
Hey, thanks so much for listening, and I hope that this podcast has been informational. And until then, all of you have a great day. Thank you.
Thank you for being with us today. Since 2006, My Practice, My Business has been teaching dentists and their teams business skills, dental insurance contractual protocols, and state laws governing how to profitably bill patients fairly for the need-based services they provide. What's more, we guarantee our training, unlike other dental consulting companies in the industry. Simply stated, if you don't increase your net revenue, we don't get paid. We call it dental consulting the way it should be. We believe there has never been a more important time than now for dentists to experience and implement our key methods, knowledge, and business training within their dental practices. To learn more about our guaranteed, no-risk clinical business of dentistry training that is changing dental practices for the better, just go to our website, mypracticemybusiness.com, and surf our pages for additional information about our company and the services we provide. When you're ready, give us a call and get scheduled for the most profitable dental business training that you will ever experience. If you enjoyed our podcast, please leave us a 5-star review. If you have any questions, please don't hesitate to call us. Thank you again and have a fantastic day.